Dr. Andrew Miller, President AMA WA. Thanks for your time this afternoon. I just wanted to make a few comments firstly about elective surgery, which will be coming back in a reinvented sort of fashion. Like everything, we're going to have to reinvent it from the 28th of April onwards. And this is great news for those patients who are waiting in pain or with disability to get important procedures done, or having a nervous wait perhaps for some sort of screening procedure to get a diagnosis. Now our hearts go out to these people. We know that we're not going to be able to start at full capacity. We're going to have to do things differently in terms of the personal protective gear that we have, the social distancing that we have, and the health professions will be setting the example as to how to go about this in a careful fashion, get back to doing some business as usual without the risk of this terrible virus infecting our facilities and making a comeback in our society. So we're going to be cautious. On that note, we would be encouraging the federal government to get on with making telehealth available for anaesthetists, my craft group, who need to be in touch with patients for consultations before their procedures on many occasions. Like all other consultations, it's better that those aren't face-to-face at the moment, and we'd like that bureaucratic problem around getting those set up for telehealth to be solved very soon, please. We also believe that these patients are a great group to do testing on for several reasons. One, because it's bad to have a procedure at a time when you unknowingly are developing the COVID syndrome from this virus. Patients will have poor outcomes if we don't detect them being positive beforehand and cancel them. Secondly, we want to protect our healthcare facilities. Clearly, we have a problem in northwest Tasmania. We have an emerging problem in Cairns. And it's very important that we understand whether these patients are positive for COVID first, although that's unlikely given the lack of seeming lack of community spread. Western Australia is well behind the other states and the number of people that we've tested. We're doing an okay job, but we're not doing a good job yet. We're at 1.2% of the population. South Australia is on about 2.5%, and places like Iceland that have a really good view of what's happening there on about 12.5% of people being tested. So we need to increase our testing, and the patients coming into hospital for whatever reason are a really good group to look at for that reason as well. We know that in the populations where it's looked at, about 30% of people will develop this disease approximately without any symptoms, and that's how it can get around in the community. And although they're not as infective as those that do have symptoms, they can give it to other people. So it's really important that we start to test asymptomatic people quite widely. Another group we could look at for that down the track would be teachers, which may give them some better security, a better confidence that what they're being asked to do is not unreasonable. We don't want to see too many things all relaxed at once. The government's been talking about every area that's affected. We need to go slowly. We're seeing what's happening suddenly in Cairns. They have a bit of an outbreak up there. It can happen anywhere. And so we need to go very slowly and be able to step backwards if we need to. The final comment I'll make today is around getting your usual healthcare from your general practitioner as you always did. There's a lot of people who are avoiding going to the doctor at the moment for two reasons. One, they're worried they might catch something, and two, they're worried the doctors are just incredibly busy and might not have time for them. There's not much community spread. It's very unlikely you're going to catch anything when you go to see the doctor, and it's much more important for your general health that you see them for your regular checkup and to get things checked out that are new. We're seeing people who are delaying presenting with chest pain, who are delaying presenting with neurological symptoms of stroke. That's not acceptable in our society. We have great care for all of those things. It's very important that people continue to get the health care that they need, and that we overcome the obstacles for people in the regions particularly, who now, of course, have a new opportunity that they may not have realised yet, which is all this telehealth that's going on out of the city. So doctors that you have never been able to previously access if you live in the regions, psychiatrists, neurologists, all sorts of specialists are now suddenly available to you. If your GP feels that you need that kind of referral, then that's there for you, including things in allied health such as counselling and so on. So there's a big new opportunity there for people in the regions to access usual health care.
You must have been relieved by the zero new cases reported in the past 24 hours?
We're really happy when the cases are low. We then start to worry about something else because this is a very difficult place to get to have very low cases, but it's an even harder place to stay. So to keep this up is the difficult thing now, because suddenly people think, well, it's no longer a problem. I've even had people suggest to me, maybe we've gone too far with the community controls. We didn't need this because we got 0 cases. So your success can be your enemy in this circumstance, along with the virus. So we have to remain very vigilant, and until we get our testing rate much higher, we can't be super confident that our numbers are as low as we think they are, like the situation in Cairns. And if we start to unwind things, such as schooling and so on, then we need to do that very, very carefully with an eye on the numbers.
The public want to know where do you stand when it comes to the issue of schools opening. What's your view on the matter?
Well, I think that school needs to be reinvented. I see that there's a big sector, the Catholic education, who are not satisfied that that reinvention is safe enough for teachers yet, and I respect that, because no one knows their schools better than they do. No one knows their classroom better than that teacher does. So we need to listen to the people on the front line as to what they need. So the things that I would be looking for are, what is the distancing? So what's the class size? Appropriate to the age group? How easy is it going to be to keep those students apart and stop them from causing droplet contamination of teachers, given they're pretty messy little creatures, as they should be. Secondly, what's the hygiene like? What are the opportunities to wash hands? What are the opportunities to get the hand sanitizer in there? Has that all been delivered and set up? Thirdly, cleaning's very important. Anywhere where humans touch things, they can leave droplets behind that can last for hours and hours, over a day, in cooler circumstances that we're getting into on metal and plastic surfaces. Those things have to be cleaned. So those are all 3 important things that I'll be looking at. Just to start with, and I'd be respecting what the Teachers Union and Catholic Education are saying about what's possible in their area. I respect the government, and I understand education is important, and I understand that it's really important for parents that their kids are getting socialised and educated, but we've got to take it very slowly, because what we don't want to see is outbreaks in schools, shutting everything down, ruining a whole facility.
Is it confusing for parents of looking at the private schools or the Catholic schools that are doing everything online and public schools are staying open? Do you have anything to say to parents about that? Obviously, is it mixed messages perhaps?
Well, we've had a lot of mixed messages through this whole process, and you have to have sympathy, because this is unprecedented. None of us alive have done this before. So I would say to parents, trust your gut. Go with what's right for you and your family and your child. Some children need to be in school. Some parents don't have the capacity because of their work or for other reasons to be in a place of having their kids at home all of the time. But if you have doubts about how things are going to go, then personally, if it were me, I would wait and see exactly what the arrangements are at the school and see if the teachers are happy. Once things have calmed down a bit and everyone's psychology is okay, psychology is just as important as physical safety from the virus. Once the stress is reduced in the situation, then reassess as we go along. Community spread does seem to be very low. Otherwise, we would be yelling, stop, don't do this right now. But we'll have more confidence about that when we see more testing and when we see what the arrangements are in school and how safe they are. And I think everybody understands the principles now that we need for that.
There's always a turf war amongst parents. As I say, some argue, there's a group says send them to school, the other group says keep the kids at home. I'm not asking you to pick one group now, but what I'm asking you is, I suppose, which one is a better option?
Okay, so
For parental assessment particularly.
for the parents trying to decide whether the child should go to school, I think take into account your own personal circumstances, what the situation is at your particular school with your teacher. Talk to the teacher if you've got some doubts about how it's going to go, and remember, it's not an irreversible decision. So if they go along one day and don't go along another day, that's not going to be a huge problem. This is a short space in time in history. It's important that we get this right so that there can be confidence with the next steps. But don't feel bullied into anything. Do what you think is best for your family.
Teachers are being fairly worried about their own safety. Do you have a message for them? Do you think there are enough safeguards in place for these teachers?
In terms of teachers, I have a huge amount of sympathy for teachers. I think we see a lot of parallels with healthcare workers who, particularly those who work in the state-based system with teachers and incidentally with other state employees, because there's been a long-term reduction in resource to these areas, so that all the fat in the system was gone long ago, and they've often worked in a very stressful environment, and there's been a high burnout rate and difficult to attract a lot of new people to stay in the profession, so in some ways an older working group. So my message to teachers would be the same. Do your own risk assessment about the situation you're in. Communicate closely with your organisation like your union, and I think teachers also are smart enough to understand the risks here and what it is that they need, and we must listen to them. I get frustrated when I hear around the world, not just in Australia, politicians praising the people on the front line, but not listening to what it is that they're asking for. Now, obviously, we've got it good here compared to what they're going through in the UK and in New York, and we're in constant contact with those people, and we're just feeling, in some ways, guilty what other countries are going through at the moment whilst we live here in our relative cocoon. We're not going to risk going down that path, and we're not going to risk having our people, in terms of healthcare workers, put at unnecessary risk in the workplace. And I think, quite rightly, I'm getting the same kind of messages from teachers in our community that they deserve our respect, they deserve our support, they deserve us listening to them and giving them what they need to do their jobs safely.
Just one question before we finish. Should teachers wear PPE in your view?
Whether teachers need to wear PPE will depend on the distancing and the other situation in the classroom, and I think we should listen to them and how they feel about their ability to avoid being in close contact with students in a situation where they're likely to get droplets on them. I would imagine that in the younger age groups that may be a greater concern, but really it's up to teachers. The other thing that they may want to think about and have a discussion with the government about is going to be around whether there's going to be fever monitoring in our schools as there were in the Singapore schools before they eventually had to close them. So I think that some countries find that useful, but certainly you wouldn't want people with a fever to be in your school. But that's something for the teachers and the government to thrash out. We'd be happy to give health advice as required.
With elective surgery coming back next week, how do you deal with the challenge of getting rid of that backlog, basically? What do we face ahead?
So we're prioritising with the proceduralists and the hospitals which things are obviously the most needy in terms of people who are suffering, and then we're not worrying too much about the huge backlog. We know that it's always there. We deal with this all the time in an under-resourced system. We've had ambulance ramping with us for a long time. So we're used to prioritising on an ethical basis. We will do that, and we're not going to let that overwhelm us. We're not going to cut corners. We're not going to do anything that's unsafe for either the patients or for the staff working in facilities. So we'll work through that within the constraints of the PPE shortage, potential drug shortages, but we certainly have plenty of staff available, and some of those staff getting that elective back and going, they've been laid off. Bringing them back will enable us to train them for COVID as well, because in the private system there's been a lot of people who just haven't been going there. So it will be a positive thing from that point of view as well.
Would you like to see that date come forward or go back? How do you feel about that coming back on board next week?
If it comes back in a gradual fashion, we believe that each facility's been thinking about it and talking to their staff pretty closely. So I'm not concerned about it starting next week. I think the timing's about right to look at it, given that we never know what's just around the corner. But the whole society now knows what we need to do if we see a decent sized outbreak, and we'll just have to go back to where we are now.
And just following up from what the Health Minister was saying yesterday about not flooding the hospitals, what do patients do now if they have, they're trying to get elective surgery? Do they go through their GP, their specialist? What's your advice to patients?
The ones who are already expecting to have a procedure will be contacted, and they'll be contacted whether that's going ahead or not. So they'll be given an idea of what the timing's likely to be like. Either you have to wait a bit longer, or you're pretty much got to be on standby, ready to go. And then we have to work through the issues around preoperative testing and making sure that it's all done safely.